So we talked a little bit about, I shared a little bit about the value that our practices that we're partnering with are seeing from offering these programs to their patients. Now I want to touch on the impact overall that we're seeing on the patients themselves that are enrolled in these programs, from an earlier intervention on health changes to increased patient engagement, reduction in hospitalizations. All of these are really truly driven by that added engagement on an ongoing monthly basis, right? Each of these programs, they have that monthly engagement with the care managers. And so we're seeing that health changes being detected at an earlier point, much sooner and faster than otherwise possible, or that patient has added buy-in themselves in their own treatment plan. So they're adhering to that treatment plan at a much greater level than there otherwise would be if they weren't enrolled in these programs. And then all of those combined, what we're really seeing is this reduction in nearly 40% reduction in hospitalizations across the board for those patients that are engaged in these programs, active in these programs on an ongoing basis. So just some great numbers, great positive health outcomes that we're seeing through patients that are enrolled or impacted from being enrolled in these programs. Across the bottom there for a moment, think about your own patient population, if you will, your own practice, right? Those patients that might live geographically, a distance from the practice. Maybe they don't make it into the office as often as you all would like them to, or as their treatment plan would call for them to. And so what we're seeing out of a lot of the partners that we're working with is that they're able to extend their care services by leveraging remote care management, right? They're able to extend that engagement with a patient even through those gaps in visits, right? If a patient isn't able to make it in as often as you would like, RPM and CCM and PCM, they all allow for that added engagement so that a patient can still really adhere to their treatment plan and still get those positive health outcomes from being enrolled in these programs. And then in the end, patients like these programs. We're seeing over a 90% satisfaction rate across the board from these programs for those patients that are enrolled. So just some great numbers, great outcomes that we're seeing. And we really see this across the board for all the patients that we have enrolled here through the partners that we're working with.